On the Medical Watch now, the CDC says a record-breaking 200 children in the U.S. died from flu-related illness last flu season, and 80% of them were not fully vaccinated. Dr. Michael Capello is Vice Chair of Pediatrics for Advocate Children's Hospital. He is joining us now live to talk about this new report. Thank you for joining us. This report really shines a light on the role vaccinations can play, but yet the flu vaccines in children have been on the decline really for the last few years. Why do you think that is?
Well, I think, first of all, the report really underscores the importance of the effectiveness of the flu vaccine as the leading assistance for reducing the problems that come with flu, such as death, like you mentioned, hospitalization, trips to doctors' offices, and school absenteeism, as well as reduces the spread throughout the community to the immunocompromised, the elderly, et cetera. I do believe that the reduction in vaccinations has a lot to do with what happened during the COVID time and a lot of the politicization of vaccines and people not getting their information from the best trusted source, which is their primary care physician, their pediatrician. A lot of people are searching the internet and other areas, and that doesn't always provide the best information in terms of what's needed.
Okay, so let's clear up some of those myths. What is the number one thing that a parent should know about the flu vaccine in terms of how effective it can be in preventing hospitalizations and in preventing death, really?
Yeah, it is. As I said, it's the leading reducer of flu-related risk, which is things like hospitalization and death for certain. So that is your number one thing. The other things you can do are the normal stuff, such as trying to keep your hands clean, watch good hand hygiene. If you're sick, don't go around people who are. Try and keep your areas clean, et cetera. Preventing spread. Don't go to work when you're sick. Don't be around other people. But the vaccine is the leading most effective way of reducing the flu.
Makes sense. As I talk to parents, a lot of times it seems like they're having this battle between, should my child get the COVID vaccine? Should they get the flu vaccine? Should they get them both at the same time? How do you recommend they handle questions like that?
Again, I think they should always go to their primary care physician. That should be their source of truth for everything, and talk to them through it and about it. They're both been safe, and they've both been shown in reducing the effects of both of those illnesses. And they can get both at the same time if they want to, so they don't have to have more than one trip to the physician's office. But I would encourage everybody who has those questions to sit down and talk with your pediatrician about it, or your family practice physician, because those are the people that know you the best, know your child the best, and you've trusted with them everything up since the day they were born. You've talked about feeding, growth, et cetera. There should be no different reason why you wouldn't talk to them about this too.
Okay, that all makes sense. What are some of the possible side effects, though, as families and parents are taking into account when to go in for that flu vaccine?
In terms of the vaccine, or
yeah, in terms of the vaccine, yeah.
Yeah, the side effect profile is very minimal. Typically, you may wind up with a little bit of soreness at the site. That's the number one issue. Sometimes you may have a little bit of a fever afterwards, but it's very minimal, and side effects are pretty well tolerated.
Okay, Dr. Michael Capello, we appreciate your time, Vice Chair of Pediatrics at Advocate Children's Hospital. We'll talk to you again soon.
Thank you for having me.
Up next, the